I would like to ask the Minister for Health and Social Care which areas, if any, of Nobles Hospital would be considered unsafe if the same standards and inspections were applied in the same way as they are in hospitals in England.
Calling the Minister for Health and Social Care, Mr Ashford, to reply.
Thank you, Mr President. As the Honourable Member will appreciate, there is a large variety of varying clinical standards across the NHS. The answer could not be compiled in the time available and would take considerable time and cost to compile. It would be helpful, therefore, if the Honourable Member for Douglas South could provide further specific information regarding those standards in particular that she would have us review. I am more than happy to discuss this in more detail with the Honourable Member to see what information we can provide in a cost-effective way.
Mrs Beecroft, supplementary.
Thank you, Mr President. I'm sort of a bit disappointed that there was sort of nothing more in the answer, but I would ask the Minister, is he aware then that his Chief Executive, when I was Minister, informed me that Nobles was a mid-staff situation and he feared that? And I realise it's some 10 months now since I've been sacked, so the situation could have changed since then. But is the Minister also aware that I understand that his Chief Executive recently said in front of staff that if the CQC came in, they would close the doors and put tape over them?
Minister to reply.
Thank you, Mr President. In relation to the CQC, we don't have the CQC doing any inspections, so it would be hard to say that that would be the case, because in terms of the CQC, unless they undertake inspections, how would you actually know what you're complying against the standards? But in relation to the standards, which was the basis of the question, Mr President, I'm not trying to be awkward with the Honourable Member, I'm actually trying to assist, because I should point out that the way that standards are measured in NHS England, for instance, the CQC, which the Honourable Member's raised, has 8 core service areas, 5 key domains, and all of those are broken down into subgroups. So just to give Honourable Members an example, and this is going to make me very unpopular with the Isle of Man Green Party, I actually have here a combined list of all the standards and frameworks applicable to NHS England. Now, as Honourable Members can see, it's not exactly a small document. So if we were to try and apply all of these to an NHS our size, basically it would cost an absolute fortune, and every penny we spent on applying these standards would actually be a penny not spent on frontline health. So I'm happy to work with the Honourable Member, and if she says which framework or set of standards she wishes to see and compare against our NHS, we will look where we can to see what information we can get her.
Supplementary, Mrs Beecroft.
Thank you, Mr President. Is the Minister aware that the Law Commission is of the opinion that because we are all British citizens and that we should be therefore entitled to the same standards? It doesn't say that we should have to carry them all out on Ireland, but we should be entitled to the same standards of care and clinical governance as everywhere else in the British Isles. And whilst the Minister said that CQC do not come here, I think I'm aware of that because I've been pushing for them to be an independent regulator, and the Minister has confirmed that he agrees with that stance, which I'm grateful for, but I didn't say that they were able to. I said that was a comment made by his Chief Executive fairly recently. So would the Minister not agree that his Chief Executive must have some reason for having said that in the first place, so he must have concerns? Sorry, do you want me to move on to, or shall I ask another supplementary?
One question at a time, Mr Ashford.
Thank you, Mr President. Like I say, I'm not aware of the Chief Executive making that comment. That's the first I've heard of it. If indeed, I'm not going to comment, obviously, on third-party speculation. It's not a comment, as far as I'm aware, that has actually been made directly, publicly by the Chief Executive of the Department. In relation to standards, and I quite agree, we do need to have proper standards in place. There is work and review going on at the moment in relation to NHS outcome frameworks, but they need to be appropriate for the island. And I think we do need to get a bit of realism in, Mr President, that what we're operating NHS-wise in the Isle of Man is very different to NHS England. So we are dealing with Nobles Hospital, Ramsey, what compared to NHS England is a limited number of GP surgeries. And so just to give you an example, one of the reasons they have all these standards in NHS England, and I must say personally, I do actually question whether all of these standards do actually add value, specifically since many of these standards were in place prior to the Francis report and the Berwick review. which found serious failings, but NHS England is dealing with 207 clinical commissioning groups, 135 acute non-specialist trusts, 17 acute specialist trusts, 54 mental health trusts, 35 community providers, 10 ambulance trusts, 7,454 GP practices, and the NHS is spread over 7,331 locations and deal with 1 million patients every 36 hours. So the standards they introduce and develop are obviously trying to deal with that very large operation. The standards we should have in the Isle of Man, yes, they should be monitoring and ensuring that we have proper clinical governance, but they should be standards that are appropriate to us, not just carbon copying what they're doing across the water, which in some cases I don't think is actually working.
Honourable Member for Council, Ms August Hanson.
Thank you, Mr. President. Understanding entirely what the Minister for the Department of Health and Social Care has just said, and that we are indeed different from the UK, and I wouldn't like to see us copying any mistakes that they may make. I would like to ask the Minister that should any concurrence, you agree with the Member for Douglas South, Mrs Beecroft, on that piece of research, on what that might entail, if that might be circulated to all Timble members once it has been agreed upon and has been carried out. Thank you, Mr. President.
Reply, sir.
Thank you, Mr. President. Obviously, anything that comes from the discussions with the Honourable Member for Douglas South, which I've offered to already undertake as to which frameworks and standards she would particularly like to see. If we are able to do it, then obviously that answer will be circulated to all Timble members, because it is an addendum to this question.
Honourable Member for Ramsey, Dr Allinson.
Thank you, Mr. President. I thank the Minister for his replies. Would he agree that the performance of the CQC in England has come under intense criticism recently, particularly the way it has often been seen to destabilise primary care? And would he also recognise that quite a few of the CQC guidelines were actually implemented by the West Midlands Review Committee, who came over and gave a huge amount of advice to his department to improve the standards at Nobles?
Minister to reply.
Thank you, Mr. President. I most certainly concur with the Honourable Member for Ramsey's comments about CQC. There have been certainly queries raised within both Parliament in the UK and outside about the way that CQC has done some of its work and what benefit has actually had. But I'm delighted that the Honourable Member has also raised the West Midland Quality Review Service, because we have had the 8 reports and which actually analysed our health service across 1,046 different standards. In terms of the percentage of standards met in the West Midlands Quality Review Service, we came in at 77.63% of those standards being met, which left 18.07% unmet, of which there are work streams underway to address, which I've already commented on, and it turned out that 45 of the standards that West Midlands were going to apply to us turned out to not be relevant, so that was 4.3%. So I think overall, when you look at all the West Midlands reviews combined, although there were some serious issues identified, which we are and have been and are addressing, we actually met 77.63% of the standards, which I think holds us up very good when you compare some hospitals in the UK and how they actually match against their inspection regimes.
We must try not to be repetitive at this point. Mrs Beecroft, please.
Yes, thank you, Mr. President. I'm sure the Minister is aware of a written question that I have about the key standards later on in the order paper, so I won't go over those again. But I'm sure he will recognise that it's very different having reviews done by people and having reports rather than a statutory regulatory body who actually has some teeth, because with all reports in the world, they cannot make us do anything, even if they think it's extremely urgent. We just decide whether we wish to take their advice on it or not. However, I would like to move on to another area so as not to be repetitious, and this is the centralised HR system that is currently used. Is the Minister concerned about this, or are there still moves to bring that function back within Nobles Hospital?
Minister.
Thank you, Mr. President. In relation to HR, obviously Nobles Hospital is a very large part of the Isle of Man government operation, and I think it does require HR support in that regard. In relation to the centralised HR function, I think centralised HR function, which I was in charge of when I was back in the Cabinet Office, is a sensible thing to have, but I think Nobles Hospital does have certain special HR requirements, and it is important that those are met. I just do want to, not trying to be repetitive, but refer back to what the Honourable Member for Douglas South just said about independent regulation. I've already said in the House of Keys and also I think in this Honourable Court as well that as Minister I am committed to continue the drive to ensure that we can get a regulator in, and I wish to reaffirm that here today. So there is no doubt my views have not changed on that, and we will be driving forward.
Honourable Member for Ramsey, Mr Hooper.
Thank you very much, Mr President. Just one comment and a question, really. The Minister says that UK NHS standards can't apply to the Isle of Man because we're too small. That's essentially, he said, we need appropriate standards for the Isle of Man. We're too small to have UK standards applied. The smallest UK NHS trust is smaller than the Isle of Man. Staff-wise, it's got 2,000 odd staff. It has 2 hospitals, similar to ours, a very small hospital with a nurse-led minor injuries unit and a main acute function. But what really concerned me about his original answer was that there was a very heavy implication there would be a lot of work to bring all this information together, to do a comparison of our hospital on a standards basis to UK standards or UK trusts. Is the Minister saying then that there is no regular benchmarking? There is no set of standard information that could be pulled out and provided to this Honourable Court to say, actually, these are the standards that we do measure on a regular basis, and this is how we compare on those standards to, for example, UK NHS trusts? And if that information does exist, can he provide it?
Mr Ashford.
Thank you, Mr President. I'm certainly not saying there isn't standards in place. In fact, I'm very grateful to the Honourable Member for Ramsey, Mr Hooper, for allowing me to make this point. So we do have things in place. We do have a current scorecard. So, for instance, we actually mark ourselves on hand hygiene audits, housekeeping audits, falls audits, patient experience as well. We have the test your care model. We also have, obviously, the recording of the complaints, participation in various national and local clinical audits. We have peer reviews that come in as well, including the West Midlands review. We have patient quality walks that are carried out as well. And in fact, a lot of the standards that we measure ourselves again are already out there in the public domain, Mr President. They're published on the website. So, for instance, some of the things we measure that is also measured as part of the NHS standards in England is in relation to life-threatening 999 calls and the times that are taken to attend. With an ambulance, there's also a patient admitted, transferred or discharged from the emergency department. That's also measured against our targets and is published. We also measure cancer care as well in terms of patient referral and diagnostic. That is again published on the website. We also measure the time of outpatient appointments, of how quickly people are seen. That's all published. So I'm very grateful to the Honourable Member, because there is certainly no implication that we don't have standards. And I wasn't saying, Mr President, that we're too small for the NHS standards to apply. The question was about NHS England standards. It wasn't about the standards that we already apply here. And I again refer to this document, which is the full framework and NHS standard. So although Mr Hooper is quite right that the smallest NHS trust is actually smaller than the Isle of Man, the bit that is missing is they also have external support from the centre, which is a huge operation. So they're not just sat there on their own, operating in their own little environment. They have a regulatory framework that is applied, costed and paid for at a central level. So it's very, very different to the situation here. And like I say, if honourable members wish to apply the whole of these framework documents, if Tim Wood wants to vote for that, that's fine. But every penny it costs to do so will be a penny not spent on frontline health.
Honourable Member Mr Baker.
Thank you very much, Mr President. Would the Minister agree with me that the crucial thing is the outcomes for patients, and that whilst governance and inspection mechanisms are clearly an important tool to deliver these, can he confirm that he believes the right structures and processes are in place within Nobles Hospital to ensure that the right outcomes are consistently delivered and that remedial action is taken where necessary?
Minister.
Thank you, Mr President. Outcome performance is absolutely crucial. The Honourable Member for Michael has hit the nail on the head yet again. And in fact, if you look at the stats that we do publish on the website, that is what the targets are driven against, is actual outcomes for patients. This is going to sound very, very strange, Mr President, coming from someone who's a former project manager and has a self-confessed love of data. But I think we've got to be careful you don't collect data for the sake of collecting it. It's got to have a purpose, and in the health service, that purpose has got to be improving patient outcomes. Again, if I go through all the frameworks applicable to NHS England and all of the standards, I do query what benefit some of them actually have. And as I said, you know, if these standards were revolutionising the world, fine. But a lot of these standards were in place prior to the Francis report, prior to the Berwick review, and it still didn't stop those instances happening.
Final supplementary, Mrs Beecroft.
Thank you, Mr. President. I'll go back to my original question about the HR function, because this was a serious concern within the department when I was Minister. And if I can give a couple of examples, for example, one doctor, the then medical director, was not even aware that he was working for the department. She was not aware he was in Nobles. There was significant concern, and from memory, I think it was 8 doctors in 6 months were employed and working before all the checks were finished. Now, this was because of a centralised HR function. It's a very specialised area, and there was significant concern, and it was high on the priorities to bring it back into the department when I was sacked before I could complete that work. And I would really like to know, is the Minister going to pursue that line, or is he just going to allow it to continue?
Minister.
Thank you, Mr. President. What I can say is there is discussions and work ongoing with HR in relation to the Department of Health and Social Care. I can't say any more than that at this moment in time. But in relation to some of the couple of the comments just made by the Honourable Member for Douglas South, I find it very concerning. Obviously, I wasn't in the department at the time, that a medical director didn't quite realise they were working for the Department of Health and Social Care. I find that very, very peculiar, to be perfectly honest, because you would have thought the title of the job would have given a slight clue in that regard. In relation to doctors' checks, it is absolutely crucial that those checks are done before people take up posts, and I know certainly that our HR business partner has been working very hard in terms of the processes, but there is discussions with HR ongoing, but I can't say, and the Cabinet Office that holds the HR function, but I can't say any more than that at this moment in time, Mr. President.